The decision to have cosmetic eye surgery can be very personal. Eyelid surgery is among the top 5 cosmetic procedures performed in the United States. Some people do it because they want to look younger. But for Lorraine Gontarski, having ocular plastic surgery at Memorial Hospital was necessary to correct a debilitating vision issue caused by chronic dry eyes and thyroid eye disease.
Well, I was having a problem. The right eye had to be propped open. It was like a lazy lid. It didn't want to stay open on its own. I couldn't read very easily. I had to use just one hand to hold a book, the other hand to hold the eye open. And the same with watching television. It's getting so I really didn't enjoy that quality of life.
Thyroid eye disease has a huge range of symptoms, ranging from dry eye symptoms, pain, discomfort, irritation, redness, blurred vision, tearing, to double vision, to blindness, depending upon how severe it is. And these are the patients who have severe bulginess of their eyes, and these things can all be fixed. Most people are not aware that we can repair these things and give them normal looking and normal functioning eyes.
So I decided to check in to see what could be done about it, if anything could be done, because I didn't really think that anything could be done. And then I found Dr. Quitko and found out that, yes, he could do something, and he was all set for it.
The most common reason we see for droopy eyelids is old age. There's a muscle that raises the eyelid, and as we age, it slips off the eyelid, and people's lids droop. And it can cause problems. It's like looking through a window with the shade pulled down.
When I first met him at Memorial, I asked him, about this muscle bit, and he said, well, you have dry eyes. We have to fix that first, and then we'll fix the lids. He said, call my office and make an appointment. So I did that. And the next week I was in to see him, and a couple of weeks later I was in the hospital having the procedure taken care of.
Well, basically, we do a complete eye examination on you, make sure that your eyes are healthy. We document if your droopy eyelids are actually causing vision problems, and we do this with a visual field machine, which measures your peripheral vision. And we can document if you're losing vision. And this is done for insurance purposes, because sometimes insurance companies will pay for it if we can document that you're losing vision. We'll do a complete eye examination on you, take photos, which we may or may not have to submit to the insurance company, and then we sit down and talk to you and decide if it's something that you want to do. We can show you how much better your vision will be, but most of the time people come in already knowing what their problem is, because they'll come in and say, Doc, I actually have to physically pick my eyelids up with my fingers to see better. So they know that there's a problem there, and they know how it will be fixed, that basically they need their lids elevated. We just document everything and make sure their eye health is fine.
It was outpatient. Went in at 5, 6 o'clock in the morning, and I was out by noon. It was amazing, and that was for the first eye, and then the following 2 days later, the second eye, the bottom lids. And then about 3, 4 weeks later, I went in again, and the upper right eye lid was taken care of, and then 2 days later the other eye was taken care of. And within a week I was practically normal. Wow. The dry eye condition had cleared up. I didn't have to put drops in every 3 or 4 times a day. Nothing. Everything was just perfect.
The facility is wonderful. They have all the equipment that we need. It's all up to date. The staff is wonderful. I've known a lot of them for a long period of time. I have my own staff in the operating room. When I operate 2 days a week, I have 2 operating rooms, and I have the same group of people I've had for many years. And they're just wonderful people. They know their stuff. We turn rooms over very quickly. They treat the patients very, very well, and you couldn't get better care anywhere.
Oh, everyone there was just so pleasant and so helpful, and they just couldn't seem to do enough for you. Oh, they babied me. They made me feel at ease and comfortable, everything was just terrific.
I see the patients post-operatively, and the vast majority of them will actually take time out to mention how good the care was at Memorial and how kind the staff was to them. And surgery is a stressful situation. You go in, you're uncomfortable, you're stressed, you're very nervous, and anything people can do to put your mind at ease is helpful. And more often than not, my patients will tell me how wonderful the staff was at putting them at ease and making them feel comfortable in an otherwise stressful situation.
At one point, a child, as I was walking in the mall, had said, "Oh, Mommy, look at that lady's eyes. Look at her eyes." I don't feel embarrassed like that anymore. I used to read like 156 books a year, and I had dropped down to 20. So now I'm hoping to get back up again. Avid reader. But I'm also enjoying television more, which I hadn't enjoyed in a while, so everything's just great now. There's no reason not to go and do something about it. You should. No matter what your age is and no matter what the condition is, you should do something about it and avail yourself of the doctors and the facilities and everything that's there available to you. You should do it.
Did you know that in 2012, cosmetic eye surgery was performed on 130,000 women and 23,000 men? So if you have one of these vision problems or any vision concern, don't wait. Your swift action will yield the best results. Call the vision specialist around the corner at Memorial Hospital of Tampa.